Hi, and welcome to Healthy Living. We're going to look now at a patient that has a bunion, but they also have a injured toenail. Do you see this toenail right here? This patient was an avid runner, and they came in because of the toenail. They weren't concerned at all about the bunion, but they were concerned about the toenail. And their concern was, well, is there a fungus in my toenail? You can see it looks a little black, it looks a little discolored, and you could just treat the toenail. But why do a lot of runners get a black toenail? And in this case, one of the problems is actually the bunion. When you have a bunion, and just to explain, a bunion is a protrusion here on the outside of the bone. Okay, so you have this bone that goes out, and because of that bunion, for many people, if you look at the X-ray or even if you evaluate the foot, this toe, if you try to lift it up, it doesn't really lift up that well. It gets some jamming in here, and that would be another condition that's related to a bunion. It's called Hallux Sliminess, because the hallux, which is this toe right here, is limited. It doesn't go up as much because of the bunion. The bunion kind of restricts it. Okay, so one of the treatments, of course, is to fix the bunion. If the bunion doesn't hurt the patient, though, and their main concern is the toenail, sometimes you can do insert an orthotic. And having that orthotic drop down this bone a little bit can be effective, and that can give better range of motion in this to treat that nail that's injured. But for a lot of runners, they actually lose their toenails. And people that are doing marathons or ultra marathons, you can lose the toenail because your foot swells in the shoe, or because you have a lot of jamming forward and backward into the shoe, and sometimes that can develop into a fungus that's in there. So instead of treating the nail here, sometimes we can treat the foot using an orthotic. That can help it. If the nail does hurt, we can treat it. Sometimes there's a fungus in there, or sometimes it needs some type of another treatment. Also, people that get a lot of jamming, they can also develop a ingrown toenail as well. And it's not just a fungus, or it's not just black and blue or a blister underneath the nail. And people also have a question, well, what do I do if my toenail is totally black and blue? Do I need to poke a hole in it with a needle? Do I need to do something? Normally, we just leave it. Okay, you just let time grow out the toenail, and just as a reminder, to have a nail grow from the base all the way out, it takes about 9 months to a year. So you have to be patient, let that grow out. If it detaches too much and it snags in your sock or it becomes painful, then you should seek someone else out. Or if it develops like an ingrown toenail, that would be something to check out. So just to be aware, if you have a bunion, sometimes you can develop toenail problems. That's how bunions are related to toenails and even some black and blue underneath the nail. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.